So apart from eating healthy food, is there anything else that you can do very easily to manage this PCOS? Yeah, it's so obvious there on the slide is to move more and to become more fitness conscious. Do simple exercises even in your everyday, in your college. Take your stairs, not the lift. I know you don't have the privilege of taking the lift. You would use a lot of stairs. Please practice to at least about 15-20 minutes in your home to ensure that you take up some kind of a fitness routine so that you help your body to consume this glucose basically and thereby break the insulin resistance. So as you see here, some kind of an aerobic activity will definitely benefit. So when it comes to PCOS, all of them think it has to be medically managed. But the beauty around here is 50% of the treatment is about the lifestyle changes that you can adapt very easily in your everyday practices. The selection of the food that you make and the amount of activity that you do. So going on to the next slide. Yeah, and a lot of vitamin D and sunshine would also benefit you because I'm seeing the 9 out of 10 who come into my clinic are found to be vitamin D deficient. That's because most of us are always in front of the laptop, sitting inside the room. We don't want to get tan in the sunlight, and that's why now we're very commonly saying vitamin D deficiency. So please go out, enjoy the sun, and get yourself tan because that's a beautiful tan for you. That's a very healthier one. So the next slide is, so when you beat this insulin resistance, it's not only the PCOS that we are talking about. There are a lot more other problems that you will not be having to face. That's the list of the problems that you can see on the left hand side. Apart from the PCOS, how it affects the liver. Basically, the metabolism of the body gets affected. So what happens in turn is the early onset of diabetes, hypertension, fatty liver, all these sets in. So by just simply doing or practicing 2 things in your life, you may probably not see any of that. Isn't that not really easy and interesting? I don't hear a yes or a no here. Okay. So that's the whole point. I think all of you would by now be clear. So once you have done this, 50% of the treatment is over and the rest 50% is only lies with gynecologists like us. So I think next time when you go to a gynecologist, she will definitely thank me because she will see that you all are already aware and 50% going to be treated. Take a self-treatment for yourself. So here, with knowledge, we conquer the PCOS, and thank you all of you for giving me this wonderful opportunity. So any questions to me?
Myself, Priya from the PCOD. So I got first diagnosed with PCOS when I was doing my 7th standard, and I struggled a lot with lack of hemoglobin level and all. And recently I found out it just had an assumption whether finally my PCOS got recovered, but I do have a 45-day cycle. It is normal cycle or regular PCOS?
Oh no. See, we call a cycle to be regular and normal when it need not be that perfect 28 or 30 days. It can be anywhere from 21 days to 35 days. So this is called normal. So when it goes beyond 35 days, then yes, it is irregular cycle. So we see a lot of patients who are diagnosed with PCOS, but within a couple of years who have started to, good lifestyle change, become more fitter, lose weight, are completely normal and they don't even see any problems that happening because of it. So that's why, we would like to educate you young people to take more control on your health. Yeah?
White discharge is very common to everyone. Is it harmful or advisable?
Okay, see, white discharge has a different consistency during the cycle. you would have noticed that from day 7, which I mean by day 7 is considering day 1 of your cycle as the first day of the periods. From day 7 to day 14 of the cycle, yes, women experience something like a watery discharge, which is quite normal. And after the 14th day, it becomes more of a bit thicker, mucoid consistency, but it is still transparent. So when should you be worried about is when this white discharge starts to change in color. It's more altered color, it's blood-stained or brownish, or it gives you some itching, or it has a foul odor, and that is when you need to take some help. Yeah.
So is PCOS only related to the time, like does it only relate to the cycle, or is it also
answer
she vomits sometimes? Is this also a sign of PCOS?
Okay, that's a very, very good question. We see that mostly in PCOS, the cycles most of the time, not always, are painless. Why? Because they get the periods they do not have this ovulation happening on a regular interval. So the cycle does not happen once in 30 days, it comes after 40 or 45 days. When that happens, the flow is heavier, but surprisingly, it does not give them pain. Most of the patients, if you see, and most of them, they would say, it's a painless bleeding, madam, I do have heavy bleeding, or sometimes they said even after 45 days I have normal bleeding, but it is painless. It is not very painful, not even like a normal menstrual periods. So that's about a PCOS. Probably there is something else that is not being diagnosed that has to be looked into.
My question is, what age group of women are more prone to getting this syndrome, and whether women going through menopause can get this, because a lot of the symptoms are very similar to symptoms of menopause.
So your question is to know what is the age group of women who experience this PCOS?
What age group of women are more prone to get this syndrome?
Get PCOS. That's a very nice question again. Yeah, earlier we used to see this in an age group of about 30-35 years, but now the story has changed. You're seeing it in younger individuals, like from their teenage, say 16, 17 and from 18. And that's to blame our lifestyle, which I would say is a very sedentary lifestyle. And on top of it, we eat a very rich food, fatty food, and on odd hours. So that's again the most important thing is about the timing that we eat the food. So you have to people say, please avoid eating food after 8 o'clock and 9 o'clock. And you would have seen a lot of celebrities giving speeches saying like, we don't consume food after dinner after 7 o'clock. There is a lot of science behind it, because your body you give adequate time for the body to consume that glucose and to utilize the calories that you have consumed. That's the idea of having an early dinner. Say somebody is going to have a dinner at 7 o'clock, there will be some amount of movement until they go to bed at 10 o'clock. Whereas a person who is going to have a dinner late at 9 or 9:30, you are not allowing the body to consume the amounts of glucose and the calories. And that's when it becomes and converts itself into a fat. So when the glucose is not consumed by the cells and tissues, it gets converted into fat. And that's when you start putting on weight. And that's the secret of these celebrity diets. It's not about vegan diet, it's not any paleo diet, it's simply the timing that they eat. And that's what is a smart choice that you should learn to do. So thank you so much. It was wonderful interacting with all of you. Thank you.